Doctors have a warning for parents tonight. There's an alarming rise in cases of walking pneumonia in young kids. WFMY News 2's Joseph Leonard spoke to local doctors about what you need to be looking out for.
If your child has a dry cough, a low-grade fever, or feels fatigued, it could be cause for concern. Doctors say walking pneumonia cases went up sevenfold in the past 6 months. Walking pneumonia is on the rise, a jump from 1% in April to 7% in October among children ages 2 to 4, and a 4% jump for kids between 5 and 17 years old.
This is typically something we see in that older child or teenager, or think about it more in that age group, and now it's much younger, along with all the other usual things with RSV and COVID and everything else.
This type of pneumonia is especially stubborn because it's immune to typical medicine like amoxicillin or penicillin.
We don't typically use a lot of azithromycin routinely. I'm sure the pharmacists are seeing a nice uptick or having issues with supplying it if they're using their usual numbers to order things. So there may be a challenge for parents right now in trying to find it.
Doctors say with the common cold, symptoms get better within days. But for walking pneumonia, it gets worse each day. So if you notice your child has a lingering cough, it's time to take them to the doctor.
If you notice that they're having any difficulty breathing, sometimes their skin can turn kind of a bluish gray color. That would be a reason to take your child to the doctor, the emergency room. They're experiencing chest pain. If they have a fever above 102 degrees, if they have a cough that has discolored mucus or blood in that cough.
Now, doctors say this type of pneumonia is usually more mild, but with kids back at school, it could make it easier for the disease to spread.